You are welcome to today's update as always. I want to start off with Australia today, where we've got a bit of a worrying trajectory in Victoria and on the east coast of Australia. Then the United States we'll have a look at. Particularly want to look at obesity in the United States this morning, which is really at epidemic proportions in the United States. We'll have evidence that the data from Iran has been less than accurate for some time, as we've suspected for many months on this programme. Interesting study in the UK from Liverpool, not so much a study as a practical approach to localised ways of managing the pandemic in Liverpool, which is interesting. And then we'll look briefly at Brazil, India and South Africa to see what's going on in the rest of the world. So these cases in the globally, we know these are minimum cases, of course. The real numbers are going to be higher. Now, Australia's done very well to begin with, so the total number of cases and deaths has not yet climbed. And the Australian government are very good on giving lots of interesting data, so click onto that by all means. Link and evidence, as always, in the description. Now, Victoria, that was yesterday, that was the day before, a number of new cases. The reporting in the early part of the week, of course, is always lower because of the influences of the weekend. So 11,000, just under 12,000 cases now, and half of those, more than half of those, are active. So that shows that the rate of increase in Victoria has been increasing, and the death rate we can expect to increase, unfortunately, because of the large number of active cases. And we always know there's a delay between active cases and deaths. So week 23rd to the 29th of July, for which complete data is available, over 2,500 reported cases, and that's an increase of 2,200 to the week before. So it's a huge increase. Now, the total numbers aren't yet massive, but with that level of increase and that degree of doubling, it wouldn't take long until they were. Now, this is interesting, and it's true in many places of the world. No, not all of the cases. Now, the cases do span all age groups, but most of the cases are in younger people, reflecting behaviour patterns in younger people. So the vast majority of the cases in young adults and indeed teenagers, even younger than teenagers. So most of the new cases are in the younger age group. And approximately 6% of the cases recently diagnosed have been admitted to hospital. Now, this is pretty alarmingly high. Of course, it's not the total number of cases that there exist. It's not the infection fatality rate. It's more the case fatality rate, well, hospital admission rate rather than fatality rate. Because a lot of people, of course, are going to have very mild or no symptoms. So these are people that are getting tested who then go on to go into hospital. But even so, 6% of those testing positive requiring hospitalisation is reasonably high number requiring hospitalisation. Now, Daniel Adams, the governor, has responded quite assertively. 6-week curfew. It was quite a staunch measure, really. One person per household to shop. He's described Victoria as in a state of disaster. Masks mandatory when leaving the house. Can only travel within 5-kilometre radius for shopping or exercise of the house. That's about 3 miles. It's what we call a stage 4 lockdown. So really quite profound measures introduced there by Governor Andrews in Victoria. So a lot of things closed. All religious centres closed, for example, churches, mosques, temples, whatever, all shut, and a lot of these things all closed as well. All schools except for people in essential work. Elective surgery cancelled. We've seen so many problems with the routine medical treatments that get cancelled. So, yeah. Anyway, that's what's happening. And these things are open. These emergency facilities are open. This kind of makes sense. Take away food, click and collect. So you just go on the line, click what you want and pick it up outside the door of the hardware store. Still open. Heavy fines in place for breaches. So quite firm action, I think it has to be said, been taken there in Victoria. Now, I actually would expect these levels of measures to be successful. I would be hopeful that these would work. Now, I know everyone's absolutely sick and tired of all these measures and the restrictions and everything. But the point is, we're getting close to the time now where we'll be able to control things using other methods. So, for example, in the UK, we're starting to introduce testing now, where someone can get tested and get the antigen results within 90 minutes, almost lifetime data. And hopefully it's going to be cheaper as well. So we are getting to the state now where if we just hang on for a bit longer, just keep on with these basic public health measures for a bit longer, it's not going to be too long before lifetime testing comes on stream, and then a few months after that, hopefully vaccination. So it is, in my view, worth making this effort that Governor Andrews is making in Victoria. So if you're watching in Australia, I'm sure most of you will realise the importance. In fact, I'm sure everyone watching this video will realise the importance of carrying on. Now, I like to base things on science, but the world has been a bit weird this year. The thing that I found really strange was plagues of locusts in Asia and in Africa, devastating food crops. There's been fires in Southern California, hurricanes going up the east coast of America. Not quite sure how fast those winds are now, but they're certainly interfering with things like outdoor testing. Then, of course, we've got COVID-19. So few problems have come all at once this year, really. And many of those are affecting the southern United States at the moment. Now, cases in the United States, I'm not going to spend time arguing about the data today. They're going up. 48,000 cases, but again, affected by the weekend. Well over 4.5 million cases now. Now, the New York Times is reporting an average of 61,850 new cases per day on average for the past week. So that's the average number of new cases per day over the past week. But this is 7% less than 2 weeks ago. And yet all the news agencies in the United States are saying that cases are soaring. So I guess what it means is that cases are soaring, but they aren't soaring quite as quickly as they were 2 weeks ago. The rate of acceleration is down. So that number is 7% higher than it would have been 2 weeks ago. But of course, this is still adding up to very large numbers. But I have to say that the numbers in the United States aren't quite consistent with the reports that we're getting about surging cases all around the country. And I'm going to illustrate that by what Dr. Birx has been saying, the White House coordinating team on COVID-19. Dr. Birx is saying the situation now is different from March and April. She says the virus is extraordinarily widespread. She's kind of saying the virus is everywhere in the United States, I think. Extraordinarily widespread, she's saying. Personally, I prefer to talk in more concise language, but that's what she said. Rural areas, you're not immune or protected. The virus is spreading to rural areas in the United States. Crucial for all parts of the country to follow safety precautions, of course. Special warning about multi-generational households. Now, we did look at this just a couple of days ago in the UK, that Bangladeshi, Pakistani, to some extent Indian, I think, households were much more likely to be multi-generational, and the particular risks associated with that. So what Dr. Birx is saying is, and we'll notice that this is a problem in Liverpool as well later today as well. Well, it's not a problem, it's an observation. It's just that we have to take precautions about this. So what Dr. Birx is saying, if there's a lot of what she's saying is that if there's a lot of outbreaks in your area, in other words, the virus is prevalent in your area, then you have to assume you're infected and wear a mask to protect older generations. If you live in a multi-generational household, actually wear a mask in the house is what she's saying, if you live in these multi-generational situations. So if there's a lot of virus in the area, she's saying, assume you're positive. if there's an outbreak in your area, and wear a mask if necessary in the house. She's urging states with high numbers to not reopen schools, stay with virtual education, online education. Now, house parties that we've seen these ridiculous pictures of in the United States. Dr. Birx has come up with a really useful concept. She's talking about super spreading events rather than super spreading individuals. So I thought that was a very useful way to look at it. So we've talked about super spreaders away from back in January. We were talking about these, February, we were talking about super spreaders, individuals. But now she's saying it's not so much the individuals, it's the set of circumstances that can result in a super spreading event, like a party, like a religious service. So these super spreading events have been going on. That's why there's been super spreading. And she said these need to stop. Dr. Desmond Carson, California emergency medicine doctor, advising people to wear masks. And I suspect he's come across some cases here. He's saying that grocery clerks should not have to fight customers to tell customers to wear masks. And of course, Dr. Carson is 100% correct on this. So some people, a minority of course, have been refusing to wear masks when they go shopping. We saw that appalling incident a week or two ago, a few weeks ago now, where someone wasn't wearing a mask and was advised to wear a mask by a fellow shopper and actually pulled a gun out. I mean, this is outrageous. So people who are shopping should be wearing masks, and it's not to put all this pressure on the staff in the shop to instruct people to wear masks. People should just be doing this. And I'm sure most people are now, but there's been many instances where people haven't, and it's just unacceptable. Now, I was just watching an article on the news about a black woman's running club. I'm sure white people can go as well, because there's a particular problem with obesity in that sector of the population. Now, the prevalence of obesity in the United States or overweight is 42%. Huge. Now, it hasn't always been like this. This is the thing. From 1999, so basically from the year 2000 to the year 2018, the prevalence of obesity has increased from 30% to 40%, 30.5 to 40.2%. So in the past 20 years, there's been a massive increase in the amount of obesity in the United States. And this is largely due to dietary change, and it's largely due to eating sugars. So think about all the food that you're eating and try and cut back on your sugars if you live anywhere, really. But in the United States, this is a particular problem. I could talk more about that, but I'm not going to just now. But a particular point. But the point here is that the point I'm making, it doesn't have to be like that. In the 1950s, the United States was not an obese nation. Now it is. Things have changed, and they shouldn't. They need to change back. Trouble is, there's so much financial vested interest. It's really individuals that have to try and make these choices. Prevalence of severe obesity in that time increased from 4.7 to 9.2%. So over 9.2% of the population, or 9.2% of the population of the United States is severely obese. This is an epidemic of obesity. Causes heart disease, stroke, type 2 diabetes, and several cancers. All these cancers are more common in people that are obese. Breast, colon, uterine, esophageal, pancreas, kidney, liver, stomach, gallbladder, ovarian, thyroid, myeloma. And of course, these are by far the most common ones, breast and colon, but esophageal, pancreas and gallbladder are remarkably hard to treat. So reduce weight to increase your probability of survival if you get COVID-19 and to prevent all of these conditions. And this is the prevalence. Virtually half the black people in the United States are overweight or obese. Hispanics not a long way behind. Whites 42.2, not a long way behind. And of course, in the United States, when we're talking about Asians, we're talking about East Asians, whereas in the UK, we're talking about South Asians. So this means Chinese, Korean, Japanese in the United States context. Something to think about there. Something to think about. Now, Iran. We've been saying on this video for months now that the data from Iran is just not making sense. And there's been a leak. It's on Al Jazeera there. It's been on the BBC. That was the original report. It's been all over the place, actually. The Health Ministry is reporting 278,000 infections. Leaked government report shows 451,000 infections. So the numbers have been deliberately suppressed. This is not messing up. This is deliberate deceit. Deaths, likewise, official health ministry numbers, leaked government numbers. Now, the point is, governments all over the world seem to be fiddling their data. Now, this does not help us understand the pandemic and to take effective measures against the pandemic. So why is it that governments are fiddling their data? What have they got to gain? Well, I suppose if you're in charge of a country, you want to show how good a job you're doing protecting your people. And if that involves lying, then what's the truth? It's only a pandemic, isn't it? It's just an appalling situation. What an appalling indictment on political leaders all round the world. That data is being deliberately falsified in many, many places, and places where it's not being falsified, the way we collect it and the way we do this, that and the other is a bit, a little bit a little bit way, it's anyway, it's not good. Now, the UK, the COVID symptom tracker app, 2,110 new cases per day. Way higher than the official figure, of course. But what is interesting is that when I compared this a couple of days ago with the data from the antigen analysis covered by the Office for National Statistics. So the Office for National Statistics every week will go out and test so many people in so many households in so many parts of the country. And from that they can work out how many cases they're likely to be in the country as a whole. And their numbers are similar. They're around about the 2,000 new cases per day in the UK. The COVID symptom tracker app now has over 4 million people reporting. I've encouraged you to join it many times. I fill it out every day. Well, I think there was a day I forgot, but try and remember and fill it out every day. A few days I forgot actually, but try and remember every day, and that gives lots of live data, which is really useful. Because, of course, the official government figures are the number of positive tests. And, of course, many asymptomatic people or people with low levels of symptoms don't report for tested. Therefore, they're not diagnosed. So this is not deliberate deceit. It's just the way the data is collected. So the real number there is just over 2,000 new cases per day in the UK. Now, that's right. The UK are instituting this 90-minute test. Now, for years on A&E, we've been doing this with influenza. Someone comes in with flu-type symptoms and we do a swab, and it's a PCR for the influenza viruses, and we get the result back in about an hour. So this seems to be happening now with COVID-19 as well. Now, if this is the case, this can give us live time data on who's infected and who's not, and that is a game changer. That really is. If everyone could know what their status was in pretty well live time, then only those that are infected would need to be isolated. And they would know that they would isolate themselves to prevent the spread, whereas everyone else can carry on with their life as normal. So almost lifetime data would be transformational, and it's coming. It's coming. It's starting now. Now, frustratingly, I can't find the scientific data on this yet, but as soon as it comes out, I'll try and make sense of it. Now, this caught my eye. Liverpool. Local plan. Much more likely to succeed than nationally imposed measures. So this is Matt Ashton, who's the Liverpool Director of Public Health. So what Matt Ashton is saying is that local areas or local problems in local areas, increase in incidents in particular areas, can be dealt with locally, but with local expertise and local knowledge and local cooperation and collaboration, much more than a government top-down approach can work. And I must say, throughout this pandemic, there has been very, very little local involvement. So I have never read any press reports locally from my Director of Public Health. What's he been doing? I'm sure he's been busy, but I don't know what he's been doing. He hasn't communicated with me or anyone I've talked to. So rather than these national government things, it's local people that should be taking the initiative, led by their local officials. And this is happening in Liverpool, and it's tragic that it's so unique. He's talking about multi-generational transmission being a particular problem in Prince's Park area of Liverpool. So he's taking enhanced outbreak control action plan. This is a local initiative. Volunteers are going door to door. People that know the area, probably very often know the people they're talking to, raising awareness, ability to promote key public health messages, pop-up walking test centres, all local stuff. This is the way it should be, a local initiative. And it's sad that so many people locally that should be taking this initiative have just waited to be told what to do by government rather than taking the initiative themselves. The principle of localisation is a good one. Suspension of gathering and events just in the area. This is localised, you see. This is a smart strategy. It's not suspension of gathering and events everywhere. Vulnerable individuals should continue shielding, and this can prevent a more draconian lockdown. I think this is I think trust is a massive issue here. This is this guy talking. What was his name? Matt Ashton, the Liverpool Director of Public Health, talking. I just don't see we have trust in the national system for people to tell us what we need to do. And we saw this. If you saw the interview I did on German TV a few days ago, this issue came up. The journalist guy was talking to didn't quite get it. Didn't trust what the government was saying. Thought the government had ulterior motives. I argued strongly against it, of course. So therefore, we are much more likely to have success if we lead this locally. Leadership. If we use our community champions and leaders, our faith leaders and our volunteers, and use people who actually understand the area, live and work in the area and get the message across that way. So if someone comes to give you advice who lives and works in the area, they are of the people in that area, then of course you're more likely to listen to them than someone giving information down from on high. So it is obvious, but it hasn't been done very much. So globally we need a lot more local initiatives. And very often we simply haven't seen them. And the response from the community to the new measures taken have been described as phenomenal. So there you go, more localisation required of response, targeted to the particular need at the particular time. I've no time for details today, but Brazil's not going well. India's heading in the wrong direction. Over 50,000 for the fifth day now. So not particularly good there. And likewise, South Africa. Cases increasing. Now I'm going to finish today by reading you an email from South Africa. I'm a healthcare worker in South Africa. We have private practices and hospitals. So we have private practices and hospitals that's privately owned, and then we have government hospitals. So they've got this two-part sector. They've got the private sector, the government-run sector. Now she's talking about the alcohol ban that I mentioned yesterday. That's been reinstigated. Was brought back in not necessarily because it is a direct transmission driver, but because since the alcohol ban was lifted, we've seen a massive increase in trauma that's occupied hospital beds and resources that are so desperately needed. So when the alcohol ban was lifted, there was many, many more accidents and a lot more violence. And these were taking up hospital beds. So the reason the government's banning alcohol is to stop the hospital beds getting clogged up with trauma cases. We have a problem with crime and abuse and even trauma from accidents that have increased dramatically. So crime, abuse and trauma from accidents rife in South Africa. Many parts are bordering on anarchy from what I understand. Some areas. I think South Africa is very regional. So some areas are better, some areas aren't so good. But anyway, we'll hopefully get some. I'm working on some interviews from South Africa, so rather than listening to me, you'll get some first-hand information soon. Government hospitals from the first night that the alcohol ban was lifted, and skull fractures and knife stabbings. Okay, so seeing pictures of patients with skull fractures and knife stabbings still haunts me. So as soon as the alcohol ban was lifted, there was more stabbings, there was more trauma. It's a terrible time, and I guess alcohol abuse is just one way of many coping mechanisms. So many people that don't. I'm sorry, I mixed up with the grammar here. So what they're saying is it's understandable that people drink alcohol, but it's part of the problem. Our ICUs are constantly full, and the chances of a bed opening from a patient passing on is higher than a bed opening from a patient transferred to an ordinary ward. So we just don't need these trauma patients as well. Patients come into casualty and we feel so helpless because our facilities are at capacity. That's terrible. So patients are reporting for healthcare and sometimes they can't be helped because there is no capacity. Then she talks about the emotional toil and stress on healthcare workers. To be so helpless and to see so many gasping and fighting with all they have for just a chance to live and breathe again is obviously very traumatic for healthcare providers, and to see family and friends die alone with loved ones not being able to be by their bedside. So great difficulty in South Africa, and the thing that really concerns me is the World Health Organization 2 days ago was saying that what's happening in South Africa now could be happening in the rest of Africa fairly soon. Anyway, that certainly makes sense of the alcohol ban, that it reduces, when the alcohol is banned, there's less fights, abuse and trauma, freeing the beds up for other patients.